Hello and welcome to Rappin with the Rep. I am State Representative Ken Gordon, and today we're going to have a new and a different show for you, one that I've been excited for quite some time. We've been bringing to you some of the lawmakers who served with me on Beacon Hill, but today we're going to have some people from representatives from a group called Healthcare for All. These are people that serve our community by explaining to our residents their opportunities and availability of healthcare insurance and access to healthcare. With us today is Hannah Fergand. She's the helpline manager of Healthcare for All. Welcome to our show.
Thanks for having me.
And I've also got a familiar face to many of you, Marge McDonald, who is the director of the Burlington COA, has some questions of her own for Healthcare for All. One of the other representatives of Healthcare for All, Matt Noyes, came to me right after I was elected to office to tell me about some of the work that this group does. And it advocates for the consumers of healthcare, for people that have medical needs, have needs for prescriptions, mental health care needs, dental needs, and things like that. And so I was happy to have the opportunity to have you here so you could talk to some of our viewers, some of the residents of Burlington and Bedford, to explain some of the things that you do. Hannah, can you explain a little bit more about Healthcare for All and what you do for people?
Sure, and it's my pleasure being here today. So Healthcare for All is a nonprofit advocacy agency, and we work to ensure quality, affordable healthcare for all in Massachusetts. And the helpline is a service of free phone service that allows people to contact us about questions about health insurance. So we help people in English, Spanish, Portuguese, and Italian. And Mondays through Friday, 9 to 5, we answer any questions about health insurance and are able to help people in actually applying for low cost and subsidized insurance and explaining private insurance options.
Could you help the owners of small businesses that are looking for opportunities to provide insurance to their employees?
Absolutely. So as part of Massachusetts health reform, we have a marketplace called the Connector where you can purchase health insurance. A portion of it is called Business Express, where small businesses with employees of 50 or less are able to go through and purchase health insurance. And right now, it is Massachusetts law that if you have 11 or more full-time equivalent employees, you are to offer your employees health insurance, or you could face a penalty. And we can tell small business owners how to go through the insurance mall. And we can also see if they aren't offering health insurance but want to find out about affordable health insurance options, if they're able to qualify for subsidized insurance options. And there will be tax credits with the Affordable Care Act starting in 2014 for small business owners, which can help with the cost of the private insurance options as well.
So it sounds like your group is a good way for some of the business owners to get information about how they can provide these health insurance needs and save a little bit of money along the way.
Absolutely.
What are some of the most commonly asked questions that you field on the helpline?
Well, that is difficult because there's no common question at the helpline. I have been there for 6.5 years, and we get all sorts of questions. Typically, it is more likely for a caller to ask, what is my low-cost health insurance option? Or, I need health care right away. How can I get coverage quickly? And we go through their options based on their specific situation. So we screen them based on their income and household for all the different insurance options in the state.
One of the calls that I've gotten recently are from people who say, I just lost my job. I was just laid off. My health insurance is provided through my employer. What do I do next? What's some of the advice that you give people who have lost their job?
We do hear from a lot of people who are unemployed, and there are a variety of options actually for people who are unemployed. So if somebody is collecting unemployment, there's actually an insurance program through the unemployment office called the Medical Security Program. And there's actually two different options within the Medical Security Program. It can subsidize your COBRA through your former employer, so you can continue with the same coverage. They'll pay up to 80% of the premium. There's also direct coverage options, so if you don't have access to insurance through your former employer, or if it's just still too expensive, you might be able to go for a hardship and go on to a plan that's based on your income, your family's income at that time. there also might be options through Mass Health or other private insurance options depending on the family's income situation.
Can you describe some of those options under Mass Health? What's that about?
Sure. So if this is a family with children, children can will qualify for Mass Health regardless of the access to insurance through the Medical Security Program, as long as they're income eligible. Adults who are not collecting unemployment can qualify for Commonwealth care. If their income is low enough, they could qualify for Mass Health Standard depending on their situation.
So these are low cost as well as, in some cases, no cost options to obtain health care.
Yep, and it's comprehensive health coverage, meaning it covers doctor's visits, prescriptions, mental health, hospitalizations, some dental and some vision too.
That's great. And we're fortunate enough to have Marge McDonald here because one group of people who make use of the healthcare system would be seniors, and Marge works with the seniors at the COA. What are some of the concerns that you hear about this area?
The biggest concerns for the seniors that I'm hearing right now are the 60 to 65-year-olds who've been laid off, can't get another job, or retired early and didn't realize that the cost of insurance was going to be so difficult to cover. That's the biggest for them. In that, for just kind of as a surprise. For the seniors who, generally, it's just the high cost of trying to cover their Medicare insurance and things like that. But I guess, but my question would be, for the seniors who are 60 to 65 is, can you tell us, going back to Common Cause, what the helpline feels in terms of the 60 to 65 age group?
And we are hearing from a lot of people in that age bracket, especially because they just haven't been able to find jobs. They've been unemployed for a long time, have had to go out on disability. And the first thing we do is screen them for subsidized insurance options again, seeing if they qualify for Mass Health or Commonwealth care based on their income. Oftentimes they do have access to private insurance through their former employer if they're going on early retirement, but it might not be affordable and they can still qualify for a lower cost insurance option. If their income is still too high with their pension or if they were able to get early Social Security, then we might need to recommend them to go through private insurance through Commonwealth Choice. But if they're disabled, they can qualify for Mass Health regardless of income, actually. They would just have a deductible to meet.
Thank you.
What about people where one spouse has reached the age of 65 and the other hasn't yet? Are there insurance options for that family?
So there are. We do hear from a lot of couples where somebody is over 65 and on Medicare and they don't need any additional health insurance. They're all set. Their supplement all set already. But their spouse, they're below the income for subsidized insurance options and they just need to know how to apply and what type of application to fill out if one member is not actually applying for benefits. So in that case, even if the person is under 65, because their spouse is over 65, they actually have to fill out what's called a senior medical benefit request form. And this is to get through to Mass Health and Commonwealth care, because for seniors, it's a different form. They do look at assets for seniors, but if the spouse is under 65, they won't take into account the assets for the person who is actually under 65, only if the person who was over 65 was applying, where they look at an asset test.
There are a lot of people who find the paperwork a little daunting.
Yes.
Do you help people when they're on the phone with you, if they have access to the forms online, do you help them fill out the forms, go through with them?
Absolutely. So we actually are able to fill out applications over the phone, and it takes us about 5 minutes to fill it out over the phone. So we're very used to filling them out all day. It's a daunting 23-page application, which, if you look at it, doesn't make that much sense. It's in legal jargon. So we absolutely take people through. We ask them the questions based on their household, and we can finish it quickly, send it to them to verify the information and sign it, and just include whatever income proof they need to send in or other verifications that we would need for the state to process it.
Yeah, that's good. That's a great help for a lot of people. Marge, did you have something?
There's a lot of misunderstanding and a lot of lack of understanding about healthcare reform. Big topic. But can you tell us how national health reform helps or hurts the seniors? And I know
Sure.
it's a big question with
Sure.
the very small amount of time.
There is a lot of misinformation out there, and it's really getting people to understand that there is a lot of good stuff with the Affordable Care Act. It does help people, and in Massachusetts too. So seniors now, the donut hole is being closed up by national health reform. This means access to affordable prescriptions. And also, for the first time with Medicare, you can now have an annual wellness visit, which is a great resource for seniors to see their doctors. There are also additional consumer protections for seniors, so that if they're able to get health coverage based on their needs, and that insurance will be more transparent too. With national health reform, it also makes sure that seniors are having better quality care in the hospital setting, which is really important. So especially with the senior population, when there might be more readmissions into the hospitals, to make sure that they're getting quality care, not just building up the quantity.
Do you want to talk a little bit about that last little piece about the quality of the care in the hospital? Can you?
So right now, how we pay for care, it's a fee for service. And we're trying to move to a system where it's based on quality, so bundling care bundling services as opposed to paying for one service at a time, to basically look at a person and their health needs and say, well, this preventative care will actually go to help this person not be readmitted into the hospital. And this is something that hasn't been really looked at. Massachusetts passed a law in 2012 called Chapter 224 Payment Reform, which is doing a lot of work in Massachusetts to do that. National Health Reform is also doing that. And it's really going to change how care is paid for.
Under the new law, the provider is paid to keep people healthy, as
Right.
opposed to treating service by service,
Right.
sort of an a la carte way of looking at it. So it'll be interesting, especially for seniors coming in. I think there's an assessment that's done early on,
Yes.
and then the provider is there to give that service. Is there an incentive to provide in-home services for seniors to stay home longer?
Yes, I would say that there is incentive to keep seniors in the home if it's better for their health.
Right.
Yes, and so it's coordinating care and keeping seniors in their homes as long as they're able to. Yes.
Right.
And
I'm sorry to interrupt you.
better quality care would ensure that, and making it coordinated through their different physicians, and that's the incentives, changing the incentives to be based on quality and not giving all these different tests that they may or may not need. And with seniors, they oftentimes have multiple doctors. More transparency and communication between the doctors is really key and able to keep seniors in their homes.
Yeah, what I think is also attractive under the new law is the incentive to give aftercare. So after a hospital stay, people are cared for so that they don't get readmitted, which is very costly to the system.
Exactly.
I think there's more of a focus on the community care too piece of it, the area agencies on aging, obviously the VNAs, but including the senior centers who can offer programs to keep them going, keep them healthy and active.
Absolutely.
And that's one thing that I appreciate you coming out and talking to our viewers, because as you said, there's misinformation out there, and sometimes people get information off the internet or off of emails from forwarded sources where people don't really know who originated the emails. But to have people who are involved in the field willing to come out here and talk to our residents is important to us, so we appreciate that again.
Well, thank you again for having me.
Thank you. How about the area of mental health care? I mean, it's really gotten a lot of publicity now. That access to mental health care is important, and it's probably been very lacking. Are there services that you have to help people to get the mental health care that they need?
Yes, and there has been a lot of improvements in making sure that mental health care is available as any other health condition. So when people call our helpline and they're saying that they have behavioral health needs, we're screening them to see what insurance they would qualify for that would best suit their needs and connecting them to appropriate care. But under the Chapter 224 law that passed in 2012, it's making sure that care is integrated, that behavioral health is integrated so that your therapist, if you're suffering from depression, your care is coordinated with your primary care physician. And that's a big step, making sure that people's overall health is actually looked at from different physicians together. Mental health parity was passed in 2010, which allows mental health to be treated as any other health condition, and that's been a huge improvement and a victory for people who have been suffering for so long. But the Affordable Care Act also will make sure that people across the country are not having mental health treated as a pre-existing condition any longer. This is luckily something we haven't had to deal with in Massachusetts, but it's great to be able to have that. At the helpline, we do have a lot of people that call us who might have a private insurance where their co-pays are too much to get the mental health services, and they might be able to qualify for Mass Health as a secondary based on having an illness that is that's serious and needs extra attention. So that's a resource that people should be knowing that's out there.
Are there still policies that are restricting the number of visits and things like that, or are we doing away with that?
We are doing away with that. We hear about that every now and then, especially if somebody is working for an employer that's out of state. We do hear from people that do have a cap on the mental health services. And we do actually have a legal partner, Health Law Advocates, our partner organization, that we can refer cases to if they are not getting proper care. And they do a lot of work specifically around children's mental health care. So they're a great resource as well, and we make referrals to them when it's appropriate if people aren't getting the proper care.
I know there's one bill that is making its way through the legislature that addresses a case where someone changes their job and perhaps their insurance, and they've got a counselor that they're seeing, a psychologist or a psychiatrist who's no longer on the plan. I think that this bill would address the situation where someone's got to change providers. Is that something that you hear about?
So I am not familiar with this law, but that is definitely something we hear about when people, or Bill, that we hear from our callers if they're switching coverage, especially if they're going from a public program to private insurance to public program, vice versa, that the networks change and what do? I see my therapist, once, twice a week. How am I supposed to just not see this person anymore? How can I pay out of pocket for that type of service?
Yeah.
And
what can you do?
Exactly. And there isn't really the best answer. It's more you need to work with your insurance to see if somebody is in network, or you have to make the hard choice of, will you pay out of pocket? Are you able to pay out of pocket for those services? And a lot of people can't afford to do that.
Right. That's why some legislation might be helpful.
Yes.
Marge, did you have another question?
I did have a question, changing track here.
Yep.
Dental care, as I see it, is the most difficult health concern. I've been doing this for a very long time, and it stumps me every time. Many, many years ago, there were some good programs, but they have long since gone away. Lack of dental care can lead to lack of nutrition, which, you can't eat. Mm-hmm. Your health goes down and you become frailer. And I think this would happen with children as well as elders. So we see people who are failing just because they can't afford to get a tooth filled, they can't afford their dentures or whatever. So it's a particular concern to families with children and to seniors who tend to need more work than the rest of the population. Obviously, children need to go twice a year to get their teeth cleaned. Can you tell us if there is low-cost dental care and where they can find it?
So for children, they have full dental coverage under Mass Health right now. So if they're qualified for Mass Health benefits, they are able to get full dental coverage. Unfortunately, for adults, there were cuts to the dental benefits a couple years back, and basically adults under Mass Health have access to cleanings, extractions, and very limited restorative benefits at this time. And actually, the limited restorative benefits were just put back into place in the fiscal year 2013, and that was a victory from our Oral Health Advocacy Task Force and Healthcare for All's advocacy. We are promoting Restore Essential Dental in the FY 2014 budget, which will help reinstate Mass Health benefits fully for adults who now, really there's 800,000 adults that are in need of these dental benefits that they don't have access to. Community health centers and dental schools are a resource right now, but you have to check with a community health center about what services they offer. There's often wait times, so you need to contact them first. If there is urgent need, you can express that. If you're in dental pain, you can call the health center and say, I'm in pain, so they will put you towards the head of the line, hopefully. But it is tricky right now, and unfortunately there isn't that many options. Also, if they tried purchasing a private dental plan, there are not very many options in Massachusetts right now. There will be, under national health reform, more standalone dental plans too.
That's good to know for myself. What about dentures? Does any of those cover dentures, or are they just kind of on their own for that? Do you
So
have any idea?
dentures are covered in the community health center setting with the health safety net.
Okay.
As part of the dental cuts with Mass Health, basically you're able to get some of the same restorative benefits in a health center setting covered with a health safety net, but I think it's pretty difficult to do right now because of the wait times. So.
Okay.
So by restorative benefits, you were talking about fillings and things
Talking
like
about
that?
fillings, we're talking about dentures as well. We're talking about what else? Yeah, anything other than cleanings and extractions, basically. So anything else that you would need dental work that doesn't fall into those categories, that's restorative. So if you have a toothache and it turns out to be a cavity and then you need a filling, you can't get that right now. The only thing they'll do is they'll pull it, which isn't a great option. And people, it's hard to get a job if you have your teeth pulled in the front, and it's not, you're going to not be able to take in as much nutrients if you're getting your teeth pulled in the back.
Right.
Under Mass Health, the front teeth, were they covered? They were
So
covered,
now yes. So now they are covered. The front teeth, some front teeth are covered for fillings now under Mass Health. So that was the good news. With the change in FY13, people can get that covered again with.
Yeah, this highlights some of the difficulties in facing the budget in Massachusetts. It's so tight, and there is so little to go around that you were right. In the session before I took office, the decision was about covering the dental benefits, and the distinction was made, just as you said, that if they covered front teeth, at least it would help people get a job. If they had a job, they could then afford to provide for their back teeth. And when you hear that, you realize how tight money is going around in Beacon Hill and the hard decisions that are being made. And the good work by your folks in advocating for people that need this basic dental health that's important to them, that they need. So it's good that we're headed in the right direction.
Absolutely.
It does seem penny wise and pound foolish, though, to take away the dental, and then people can't eat, and then they get frail, and they get deficient in vitamins, and they end up in a nursing home.
Right.
So it's which we know costs between $10,000 and $14,000 a month.
Right, because the discussion we're having about adults, that pertains to the seniors as well as adults who haven't reached that age yet.
Well, I think it starts in the 40s and 50s when teeth start to go bad.
Yep.
So.
Yeah, it's a big problem, and we hear from a lot of people calling about dental benefits. Yeah.
You must get calls from women involved facing pregnancy issues and child care. What are some of the questions you get on those topics?
Absolutely. So we often get calls from women who they find out they're pregnant and want to make sure they have access to prenatal care. The good news for pregnant women, if they they can qualify for Mass Health at a higher income level than normal applicants. It goes up to 200% of the federal poverty level, which for a family of two is $31,000 a year. So, and automatically, if you're pregnant, your unborn baby counts as a member of the household. So that already helps you get to a higher income level. So, Mass Health will push through applications for pregnant women. They're really great about doing that. It will go through usually 2 to 5 days, we're seeing on average for women to get on to Mass Health benefits. So they really are making sure that the pregnant women get put to the front of the line for applications.
This is great. So there's no reason not to call you or call your carrier if you've got one to get these problems solved. It's not too big that these problems can't be overcome.
Right. And if a woman has insurance through an employer and it's not covering maternity, which it should, then they can give us a call and we can see if they would still qualify for Mass Health, because you can if you're a pregnant woman.
Right. Marge, did you have any last questions?
I think I'm all set. We asked about Medicare, so I think
Okay.
I'm set with questions.
Well, this is great. Now, any last comments that you'd like to make?
Well, it was great being here today. Basically, any health coverage question that you might have, just give our helpline a call. And again, we take calls in English, Spanish, Portuguese, and Italian. So our counselors are available Monday through Friday, 9 to 5. And if we can help you, we'll make the appropriate referral.
Thank you very much. So we've heard from Hannah Freigan from Healthcare for All, Marge McDonald from the Burlington COA. It's been a very interesting and a different kind of a show today, and I appreciate your involvement. Coming up, we've got a few different shows planned. Usually I've signed off on the show by telling you folks which is next. This time we've got the very nice problem of having a few people that have asked to come on, and we're going to be talking about issues such as transportation again. Remember that we had Secretary Davey, and I think you can still tune in to that show showing on BCAT. We're going to have the General Manager of the MBTA, Dr. Beverly Scott, come in talking about some of the issues involving the MBTA buses coming into Burlington and Bedford, and the MBTA subway, and some of the issues of facing that, and also facing financing for the MBTA. So please tune in to that. We're going to have Chairman Jay Kaufman, who is the Chairman of the Revenue Committee, come in and talk to us about taxes. That's a very important issue, one we're not going to shy away from on our Rapping with the Rep show. We're going to talk about that. So be thinking about any questions you may have when you see the House budget coming out on April the 10th. And if you've got any questions, then email me. I think the email address has been flashing on the screen, and it'll be flashing up again at the end of the show. But let's get ready for that. And together, Representative Kaufman, what your concerns are, and I'll address some of the concerns that I have with respect to the House budget when you see that. We've got, actually just today, Phil Sago from the Sierra Club asked if he could come in and we could have a show dealing with the environment. You may have heard the bottle bill is making its way through the House and the Senate. Talk about whether it's a good idea to extend the deposits that we have on soda bottles and cans to other types of bottles like water and juice. And another a bill that's coming through is one that would limit the use of plastics, for example, plastic bags and things like that. So we've got some interesting issues coming up. If there's another topic, folks, that you'd like to hear about that involves state state law, state government, then please email me, get in contact, and we'll try to make an arrangement for those folks to come here and address us. Because again, I think it's important for people to get primary information, get the information from the people making our laws, and not rely on rumors and information that may not be as reliable as what we can have for you. So for Rapping with the Rep, I'm State Representative Ken Gordon, here with Hannah Fergan and Marge McDonald. Thank you for tuning in, and we'll see you next time.